Capture it. Hi, Jenny. Good morning. Great to see you.
Good morning. Thank you so much for inviting me. It's lovely to be here.
Absolute pleasure. And it's really great. We're going to hear from you in just a moment. But for those, there's some on the call who won't know you, a bit of background about you. Why don't you just tell us a bit about yourself?
Yeah, I live in central London. I started working for CMF in 2019. I don't have a medical background. I've done some philosophy, some ethics. I'm coming in from that angle. And my role at CMF in public policy is something that I felt God calling me towards, to be speaking into issues, particularly of beginning and end of life, but also some other things that I'll tell you about in a minute. That's been something that's been on my heart since 2006, and it was 13 years of sort of following his will and doing all sorts of strange things that seemed very tangential to me before this job came up, and God led me to it. And it's been really cool to sort of finally to see all those different threads woven together and become a real equipping and a solid foundation to perform this role through.
Well, thanks. Well, I mean, and Jenny didn't ask me to say this, but I'm going to say it anyway. When Jenny applied for the role, I was just like, oh, is that Jennie Pollock? Because I've been following Jenny's blogs on Think Theology and other places. Jenny's a fantastic writer. So when Jenny applied, I was like, oh, wow, this would be fantastic for CMF. So, and Jenny's also written a book. Again, she hasn't asked me to plug this, but she's written a fantastic book on contentment called If Only. I've just put the link in the chat. You honestly don't have to go buy it. I'm not pushing it for that reason, but just to say that this, you do. There you go, Jenny. That's my British way, you see, of doing it, Jenny, of just encouraging people by saying you don't have to. But yeah, it's a great book, so I encourage you to get that. You can get that from the CMF bookstore as well. But anyway, I know you weren't planning to hear me say all that, but it's really great to have you on board on the team. Jenny, why don't you just share a little bit about the work of public policy? The reason we're doing this is just to help us see as Catalyst teams how this is applicable to us and how we can join on this. And then you're going to speak to Greg, who's our second public policy catalyst. So over to you.
Great, just share my screen. There we go, hope you can all see that. So I have developed this little phrase to help me understand what public policy is, and hopefully to be able to share that and clarify that with others. So we're equipping our members to join with us in influencing policymakers and informing the public and the church around issues of bioethics and medical ethics. So that we kind of put the equipping our members first, because, as I've just said, I have no medical background. I even if I did, could not do this all on my own. My team consists of me 3 days a week and a researcher, Rick, 2 days a week. So just, with the equivalent of one full-time person, there's no way that we could be having the influence that we need, whether that's at hospital trust level or BMA level or government level. We're trying to influence all those different sorts of people. And there's just no way that we could do that alone. So we want to be involving our members, equipping you, empowering you. You as Catalyst teams are particularly great for that. We love that we know that there are people who are particularly committed, engaged with CMF, with connecting your faith and your work across the country. Sometimes we have things come up in a particular area that we want to be able to ask people. So we've had a group in Southeast Scotland that we've been able to go to and ask for information, ask them to help us disseminate some information around the other Scottish Catalysts and other members in Scotland where there aren't teams. And yeah, it's just so great to have people like you that we can call on. We can ask you for information. What's going on in your area? We've heard that there's been this issue. Can you help us? Can you give me some more information on what that's like on the ground? So thank you so much for being engaged and for being there for us to contact. And then there's an informing the public and the church. So we write blogs, we do media work, we're getting that message out there, but we also want to be equipping you guys to be doing that as well. You've got much more authority being there on the ground, involved in these cases. And so that's how we would love to be working more closely with Catalyst teams. as John said, we'll be talking to Greg in a minute, who's taking a lead on that in his area. But just to give a broader sense of what we do in CMF in public policy. Oh, I have lost the controls of my screen. There we go. So we work in beginning of life, we work in end of life, we work in gender and sexuality, and a whole number of other slippery areas where things, where medicine and ethics meet, and where we need to equip members to know how to deal with these difficult things. One thing that we've been working on a lot at the moment is the gender and sexuality. We've got some members who are pediatricians or work in GP surgeries who are meeting people, particularly children, coming to them, so, their parents bringing them saying, I've been assigned male, but I think I'm female, or vice versa. How should we help them to approach that? What support can we give? What are the restrictions? What are the guidelines at the moment? And working to try and stop the government bringing in a very broad brush law that would prevent them from being able to have open conversations and explore, well, why do you think that? What's behind this feeling, this terrible distress that you're experiencing? So yeah, all sorts of other areas. One we worked on recently was vaccine ethics. John took a lead on this when the vaccine mandate was about to come in for all frontline NHS workers. John became aware that there were people in his practice, people he worked with, who were really vaccine hesitant and had some ethical reasons for why they were nervous about taking the vaccine. And we're very pro-vaccine. We want to encourage everybody to take it, but we didn't want to force people to take it. We didn't think that coercion was the right way forward. That's not something that we ask of our patients. We don't force them to take any medical treatment. So why should we ask it of our staff? And so John took the lead on writing a letter to Rishi Sunak to ask him to pause that and think again, think whether it was really the right approach, whether it was the necessary approach at this stage of the pandemic. So there are things like that that come up that we've never worked on before, but that are needs that we're able to respond to. So if you want to stay in touch with us, this is our link to get our e-newsletter. It comes out 3 times a year, and then there are little action alerts that come to the same email list as things come up and we need you to take some action, maybe to write to your MPs or write to peers, or fill in a survey, or help us with different things to really have an impact. And then we have a Twitter feed, CMF Ethics, where we're just starting to build up a feed of information that might be useful to you. John, did you have any further questions on that?
Oh, that's great. That's great, Jenny. Thank you. Why don't we bring Greg in? Is that okay?
Yeah, great. Thank you. So Greg is in the West Midlands, and he approached us recently and said, I don't know if he used this term or whether we imposed this term on, but he'd like to be an ethics catalyst. Having been part of catalyst teams for a long time, I wanted to focus his work a bit more. Greg, can you explain what your thinking was and what you want to do?
Thanks, Jenny. I think I wanted to try something that was kind of replicable and achievable for a local group. And coming back to what John said earlier about stealing other people's ideas, some friends of mine in Nebraska have been running a group in their home 4 times a year for the last, I think, 30 years. And basically what they do is they invite friends to spend an evening writing letters to either their local politicians or national politicians. Sometimes it can be companies. And the idea is to help good things to spread and to stop bad things from spreading as well, help good things to grow. And so it can be just something very basic like a letter of thanks or a letter of commendation or a letter of encouragement, or it could be a more in-depth thing like a response to a government consultation where you need some expert input. So I would envisage an evening could be something like 6 or 8 or 10 people gathering around a kitchen table to discuss the latest government consultation on this or that, and maybe you could have somebody from outside being asked to speak for 15 minutes on a Zoom call to give a bit of briefing. You could also get briefing materials from CMF or other groups, and then you get to work and start writing your letters. You share them with each other, you critique each other's letters, you suggest things that could be maybe worded differently, or just give each other feedback and encouragement. And by the end of the evening, you've got a hopefully reasonably well written bunch of letters to go off, which can be sent by email or physically, just by handwritten. And I think these days we're kind of beginning to realize that handwritten letters seem to be taken more seriously than email. So that's basically the gist of it.
That's brilliant, thank you. Yes, there's if anybody's feeling in a letter writing mood today, there is an assisted, no, there's not. There's a health and social care bill going through the Lords at the moment, and Lord Forsyth wants to put an amendment on it asking the government to introduce an assisted suicide bill. And we're being asked to write letters to peers for exactly that reason, that they get these emails that are generated. Some of our partner organisations do brilliant emails that people can just easily sign and send off to their MP or to peers, but they just get then 100 almost identical emails, whereas if they get a handwritten letter, they say that's really making a difference. And we just heard from Baroness Finlay yesterday that letters that are coming through are well written, they're coherent, and they're really appreciating that. So if you've been part of that, Greg, thank you very much. It does make a difference. It is worthwhile doing this. So Greg is one of a couple of different ethics catalysts we have that might do different sorts of things in their areas. It's a new position that we're trying to invite people that are interested to contact us and say, I'd love to be involved in speaking into ethics, speaking into public policy in our area. I've got this particular passion. Greg's is very different to one that's happening in Scotland and to others that might happen around. And so we'd really love to hear from you if you're interested and want to just talk about being, partly we're wanting to use Greg and other ethics catalysts as sort of point people for disseminating information out to the catalyst team and to other people they know are interested in the area. So we'd love to hear from you if you are interested in that.